Good morning all. Welcome to HomeoMitra Vartalaap. Today we have with us Dr. Devang Shah. I would like to introduce him. So he has graduated from Dhundu Mama Sate Homeopathic Medical College in the year 2008, and he has completed his post-graduation in Organon from the same college. He is practicing homeopathy since 2008 and has earned a reputation of treating pediatric cases and rheumatoid arthritis. His ability to make children at ease and comforting attitude to reduce patient's anxiety makes him extremely approachable and friendly. His approach in each case is based on getting accurate symptoms to find the right homeopathic medicine, as choice of medicine depends on finding exact symptoms. He is an honorary consultant at Sana Hospital, Pune, where he mainly sees cases of rheumatoid arthritis. He was assisting Dr. Sujit Chatterjee at the BAPS Hospital, Ahmedabad since 2014, seeing many cancer cases. His passion to learn the technique of eliciting exact symptom has made him travel all the way to Switzerland and learn polarity analysis directly under Dr. Heiner Frey, who himself is an authority in pediatrics. His main treatment modalities include polarity analysis developed by Swiss homeopath Dr. Heiner Frey, the sensation method in homeopathy developed by Dr. Rajan Sankaran, and various meditative approaches learned from Dr. Jayesh Shah. He is associated with the Adasong International Academy of Advanced Homeopathy, Juhu, Mumbai, as a teaching faculty, where students are impressed with the simplicity of practice and ease with which he arrives at the remedy. He has been part of the drug proving of carbon dioxide conducted at the Adasong Academy. I would like to add a couple of memories of my own while I was able to, I had the honor of working with you at the Adasong. Extremely patient man is one thing I can, in one line, if I were to summarize him, the level of patience he has is, and the level of calm he brings to the table is unsettling, is what I recall. Okay, so sir, we'll start with the first question. Okay, so please tell us something about your journey so far into homeopathy, clinical practice as well as academics.
Well, I started my homeopathic journey as a non-believer of homeopathy. It's a very long story, but I would make it very short. That when I was in third year, one of my friend's mother was suffering from recurrent cold, which is what we call as allergic rhinitis. And this friend was from my sixth standard. So I've been seeing his mother having this cold and all that for many, many years. And she did not know that, I am not a believer of homeopathy. She thought that I've got into homeopathy and I'm fully committed towards it. So my first 3 years of college just went in doing really nothing as far as homeopathy is concerned. But she asked for some medicine and we were posted for OPDs during the third year. So I used to see patients and, there were some people who used to get better. So I said, this looks like an interesting bet and let us try it on my friend's mother. She herself asked for me and she used to always carry this something in Marathi we call as tapkir, which helps to bring sneezes, which I understood as a smelling bottle. I don't know whether that's the right thing or not. But just based on that observation, I gave her ammonium sal, few doses in 30 potency. And to my surprise, her cold literally vanished. And when I saw that happening, that was the turning point in my life where I felt that this is what I want to do. And that's how my journey into homeopathy started, and I took my studies more seriously.
So if you could also tell us something about the academic aspect of your
Academic wise, I was not very well inclined. As I told you, for first 3 years, it was just like how any person would uh, work towards getting the marks, clearing the exams, and all that. But when I became serious about practicing homeopathy, then I decided, me and my friend Dr. Shrikant, he works at Prana, and we started attending OPDs on a regular basis from third standard, and especially homeopathic OPDs. the third year, fourth year, and internship went. We spent a lot of time in the OPDs and the hospital, and especially it was homeopathic oriented OPDs that we used to attend. Then later on, in the internship, I got an opportunity to work with Dr. Rajesh Gadia sir. He's an MD medicine, an amazing person as far as the MBBS or MD medicine is concerned. His diagnosis is something which beyond our expectations. So quick and so perfect. Where I worked with him for around an year, and I used to see dengue cases with him because he used to work on dengue project at that time. And I gained a lot of experience. And that time I realized the value uh, as far as the homeopathy is concerned about having the knowledge of clinical medicine. So when I started my homeopathy, I felt okay, you find the remedy and everything will be taken care of. Unfortunately, that is not the case in practice. In practice, you should also be very well versed with clinical medicine. And as I got into that, I was happy that I got associated with a late Dr. Suresh Khare sir and Dr. Pankaj Cholia sir, where I used to get an opportunity to sit and see cases. As a homeopath, since my final year, I think I got an opportunity to see patients. And Dr. Khare sir, unfortunately, he is no more, but he was an MBBS. He did his MBBS from South Africa, then he came here, and somehow he got influenced with homeopathy and he started practicing homeopathy. So I learned a lot from him, and especially what I still remember about him is even at the age of 65 plus, he used to examine the blood pressure, examine the pulse, the heart rate, and the respiratory system of each and every patient. And he used to see around 30 to 40 patients a day. And in spite of such a busy schedule, I have seen many homeopaths. I have worked with many homeopaths, but he is one of those who uh, instilled in me or who made me see that physical examination is important. And second, of course, I know who examines the patient very thoroughly is Dr. HomeoMitra sir. And I believe that this examination aspects comes to them naturally because they are basically modern medicine doctors, where the importance of physical examination uh, is given very high importance, which is something which we as homeopaths need to learn. At least if we are able to measure blood pressure of every patient, I'm sure 20-30% of patients we will come to know that the blood pressure is higher, which the patient is not aware of. And if we spot that very early in their lives, then they can be saved of many problems which can happen. Then I was introduced to Dinesh Chauhan sir because I wanted to learn case taking. So I attended a lot of his seminars and learned case taking from him. Then this opportunity of Ederson came because I was attending the all the seminars of Shankaran sir and his team since 2010. And then I applied for the residential post, and that's how I became a part of the other song.